The role of the consultant antimicrobial pharmacist evolved due to the shortage of consultant microbiologists, consultant infectious disease. So the health board took the decision to appoint a consultant antimicrobial pharmacist that would focus strategically on the antimicrobial stewardship programme of work.
Pharmacists know about medicines. That is our area of expertise.
You work across boundaries of care. My work extends right from secondary care in patients out into the community.
Yes, I have clinical commitments, I go out and see patients, but I'm also that link between kind of in the infection control department, pharmacy, the medics, and a lot of my role is advice, support, guideline development. That's a huge part of my role, and pathway development, but also really exciting things like developing an outpatient antimicrobial parenteral service.
The pharmacist will bring a level of detail and planning that often, particularly medical staff, like to speed through, and they will stop us and make us think about the detail in a really logical way.
What I feel I bring to the table is more in-depth analysis of what medication suits them best, based on their history, what they've tried before, what their comorbidities are, what the safest medication is for them.
They enable the consultant to get on with other aspects of their work while being reassured that the titrations, the medicines management and the administration of medicines are all undertaken to a very high standard. A consultant pharmacist is a crucial backbone for not just the consultant psychiatrist, in my experience, but also to the entire multidisciplinary team of clinicians.
I strongly believe that consultant pharmacists should be based outside the pharmacy department. We need to be embedded in our MDTs and we need to be part of those clinical teams.
Having a team of diverse professionals, particularly of equal status, will bring a level of conversation, discussion and strategic planning over and above a mono profession or the standard nursing doctor team.
The pharmacists I worked with are very detail oriented, and sometimes that is exactly what is needed in a busy multidisciplinary team. That ensures patient safety and the best outcomes.
The very nature of the consultant pharmacist post is that you keep their clinical expertise. It's probably the foundation of your post.
They are experts. They're very tuned in to new developments.
One thing about being a consultant pharmacist is it's definitely about influencing. It's definitely about making sure that you understand who everybody is within your healthcare system and who are the people that you need to get engaged to make sure something happens. I'm personally involved in the Physician's Associate programme. We also teach medical and nursing undergraduates, but then Cardiff and Swansea undergraduates that come up to our hospitals for placements. And we also teach non-medical prescribers both at Glyndŵr and at Bangor.
I've developed an education programme for the junior doctors who previously said they didn't have anything for them around pharmacology. So we've set up the rolling programme up, and I'm also setting up a clinical network for colleagues. It's more focused on enabling others as well and helping to develop your workforce clinically.
We, as a hospital, decided to take part in a big study that's just been published in the Lancet Infections around the antibiotic resource toolkit.
The ARC work that has been rolled out is a really good example where that was considered and thought about by our antimicrobial pharmacists and antimicrobial pharmacy team, and very much driven by them, which has been massively helpful for our health board and is now being rolled out through Wales. I don't think we would have done that if we hadn't had that investment in our pharmacy services. The easy wins have all gone, and we have got to think more strategically and think differently.
We are looking at having a team of pharmacists embedded in every local primary mental health support service.
I would always prefer to speak to a pharmacist around the contraindications, the interactions of drugs, than pretty much any other profession.